Hello, my name is Ratna Sohanpal. I'm a health services researcher and trial manager at Queen Mary University of London. I'm here to talk about our experience with recruitment in the TANDEM study. TANDEM is tailored intervention for anxiety and depression management in COPD. COPD is a global public health problem. There's high mortality and morbidity. Patients suffer substantially from anxiety and depression. Pulmonary rehabilitation is a mainstay recommended treatment for COPD management. It is an exercise-based program of 6 to 12 weeks. Waiting time is about 2 to 3 months to get on the program. People who complete it achieve great benefits, including improvement in anxiety and depression. But there's a problem of poor referral to the program, poor attendance and completion in the program. In TANDEM, we wanted to see whether a tailored psychological cognitive behavioral approach intervention of 5 to 8 weeks delivered by trained respiratory healthcare professionals called facilitators, if given to patients prior to them attending pulmonary rehab, to see if it improves anxiety and depression and encourages attendance and completion in pulmonary rehab. TANDEM is a multi-center randomized controlled trial. Patient recruitment target was 430. Our recruitment timeline was 20 months. To recruit patients and carers, we first had to recruit the sites and facilitators. We saw the process of recruitment like a snake and ladder game, lots of problems occurring, constantly having to find solutions, and we can all relate to this working in research. We experienced challenges before actually patient recruitment starting. For the NHS sites, there was a delay of site approvals by 6 to 8 months on average. The site selection was specific because our recruitment and intervention delivery timelines needed to fit within the pulmonary rehab service timelines. The facilitators had to meet our training criteria. They had to give us time commitment of 1 day a week for 3 to 6 months minimum to deliver the intervention. And to avoid contamination of them seeing control patients, if they were involved in pulmonary rehab delivery within a study site, then they could not be involved in their routine pulmonary rehab delivery. So we had to find the right facilitators and the right sites for our study. As recruitment started and progressed, we experienced challenges to maintain recruitment, and mainly it was all around staff turnover. For example, the site researcher leaving, so we had to train a new researcher. Clinician who was identifying patients for us on our behalf, them leaving, so we had to train another clinician. There was a mismatch between the number of facilitators at a site. So if there was just one facilitator at a site and if they left, intervention delivery could not happen, which means we could not carry on with recruitment. So we had to identify and train new healthcare professionals for that site so that recruitment and intervention delivery could begin again. By end of June, we had achieved 60% of our recruitment target. The funders were relatively happy with our progress, and they gave us another 9 months to complete recruitment. Recruitment was due to finish now end of March this year. We were successful in achieving our recruitment target. We did have to stop 2 weeks before the March end deadline because of COVID. But what worked for us was the interest and engagement in study from sites, wide promotion of study, working well with study team, site teams, collaborating well with PPI colleagues, piloting recruitment strategies. What we can do better is think beyond patient-specific recruitment strategies, but strategies all along the recruitment pathway, and collaborate well with every type of stakeholder involved in the recruitment process. Spending time with teams, regardless of their research experience, you can get positive results. We need to think more about contingency planning for unanticipated staff turnover. And there needs to be a lot more standardization of the NHS site approval process for timely and efficient recruitment. Thank you so much for listening. I look forward to reading and responding to your comments or questions. Stay safe and well. Bye.